Good morning. I'm Carlos Bannon, Policy Analyst at the Vegas Chamber. I'd like to thank you all for tuning into our conversation with the Department of Employment, Training, and Rehabilitation Director, Dr. Tiffany Tyler-Garner, the Nevada Health and Communications Officer, Janel Davis, and the Vegas Chamber President and CEO, Beth Sewald. Before we get started, I want to take a moment to explain some features of this call. In order to preserve the highest sound quality, we'll be muting everyone on the call besides our presenters to make it easier for everyone to hear. If you'd like to ask questions, there are a few ways you could do so. If you're joining this call on the web through the mobile app, you can ask a question by using the chat feature on the interface. We'll ask a question on your behalf. You can also ask a question by clicking the hand raise button on the interface. We'll call your name and unmute your line and ask your question. Once you have asked your question, we'll remute your line so that everyone on the call can hear the answer. To preserve time, we ask that you please keep questions brief, and we'll be taking all questions at the end of the call. Now, please welcome the Vegas Chamber President and CEO, Beth Sewald.
Thank you so much, Carlos, and good morning, everybody. I want to thank everybody for joining us today on our teleconference with the Nevada Department of Employment, Training, and Rehabilitation. We'll hear from Dr. Tiffany Tyler-Garner. We're also pleased today to have the Communications Director for Nevada HealthLink, Ms. Janel Davis. Janel, thanks for being with us today.
Thank you so much for having me. Happy to be here.
Thank you. Before we get to Janel and Dr. Tiffany Tyler-Garner, I just have a couple of announcements I'd like to make to all of you who are watching. The Vegas Chamber continues to connect with our leaders throughout the entire state in order to bring you the resources that we possibly can. We've also been working to connect our members directly with expertise and bona fide resources for the very latest in information. We've also heard from you a lot about these webinars, and we really appreciate the positive feedback we're getting. I wanted to share just one of them with you. We heard from Chamber member Allie Wagenseller of Zip Code Magazines, and she wrote, "I just want to tell you how helpful these webinars have been. In uncertain times, at least we can be proactive, and that helps me sleep at night." She says, "Thanks again for all your hard work during this unsettling time." And Allie, if you are on the call today, I really want to thank you for your kind words. The team really appreciates it. Now, before we begin, I want to just invite our chamber members to join us tomorrow for a very special webinar with U.S. Senator Jackie Rosen. And then on Friday, we have our teleconference Eggs and Issues with U.S. Congresswoman Susie Lee, and that's on Friday, April 17th at 8:30 in the morning. And as a reminder, all of our webinars and our teleconferences are posted and they're available to you 24/7 at vegaschamber.com and of course on the Chamber's YouTube page. And now it is my pleasure to introduce both the Nevada Department of Employment and Rehabilitation, Dr. Tiffany Tyler-Garner, who you're not seeing on the screen right now, but you are seeing Silver State Health Insurance Exchange Communications Officer, Ms. Janel Davis. Janel, I'll turn it over to you.
Hi, thank you so much. Can everyone hear me okay? Or Mary Beth,
yes.
Can you just take it? All right. Hi, everybody. Really happy to be here to get our important message out. I'm Janel Davis. I'm the Communications Director for Nevada HealthLink. We are actually a state agency called the Silver State Health Insurance Exchange, and we connect eligible Nevada residents to qualified health insurance plans that are certified by the Affordable Care Act. And so we have opened up in response to Nevada's state of emergency and in response to the COVID-19 outbreak. We've opened up an exceptional circumstance special enrollment period. And I want to preface this, the screen that you're seeing right now, the slide, it's a little bit outdated information. We just extended our special enrollment period on Monday. Our executive board made the decision to extend the open enrollment period. And so you have now an extra 30 15th. So we've seen a need for this, to give Nevadans more time to get coverage. So that is going to be through May 15th. And basically what that means is that if you enroll now through April, your coverage will start on May 1st. If you enroll May 2nd through May 15th, then your coverage will begin on June 1st. And a lot of you may be wondering who's eligible. And so you obviously have to be a Nevada resident, you have to be a US citizen. These are income-based plans that cover the 10 essential health benefits. You also won't be denied coverage if you have a pre-existing condition like diabetes or cancer. And again, so income-based plans, you can determine if you're eligible by calling our phone number that's listed on that page, 1-800-547-2927. In order to be eligible for this specific exceptional circumstance special enrollment period, it's basically an opportunity if you don't currently have health insurance and you missed the open enrollment period, the original open enrollment period, which was November 1st through December 15th. So I really advise folks who don't have coverage to take advantage of this opportunity, get peace of mind. It's really important to get covered for health insurance. Now is definitely not the time to disenroll in your coverage or to cancel your coverage. It's really important to get access, especially if a medical disaster were to occur. That's why insurance was designed to protect you and your family from financial ruin. We do have affordable health insurance plans available, and Nevada Health Link is the only place that you can gain access to financial assistance from the federal government. Those are known as subsidies. So in order to start the process, again, visit our website, nevadahealthlink.com. You can also give our call center a call, and we will hook you up with a broker, a certified Nevada Health Link broker, to get you assistance and get you coverage. I so apologize for my puppy barking. Let's go to the next slide. Are experiencing right now, and this is kind of what this webinar is all about, is losing your job and therefore losing your health insurance coverage. You would be eligible for a regular special enrollment period through Nevada Health Link. So we have special enrollment periods happening throughout the entire year. You usually have to report that qualifying life event, such as getting married, having a baby, losing your job, or a change in your income. So it's really important that you report that to Nevada Health Link and you enroll within that 60-day window so that you don't lose any coverage. I also want to point out that if you did lose your job or you lost your health insurance coverage, that you work with a Nevada Health Link certified broker to get coverage. There are fraudulent actors out there posing and providing incorrect information, saying that you need to purchase extra insurance coverage if you need to get a COVID-19 testing, and that is just not the case. There is no extra insurance required if you need to get a COVID-19 test. Also, if you currently have a Nevada Health Link plan or any health insurance plan right now, but you did lose your job and you finding that you can't afford your coverage, we're really recommending that you call your insurance carrier, reach out to them, and they will work with you to get your monthly premium lowered. Again, this really isn't the time to disenroll in coverage or cancel your plan. We're in a public health crisis right now, and so we want you to continue with your coverage, and so your insurance carrier will work with you. So again, start the process by visiting our website, nevadahealthlink.com/SEP, to learn about all of our other special enrollment periods. Give us a call. We will connect you with a certified broker over the phone to help you enroll. And you have until May 15th for this exceptional special enrollment.
All right, Janelle, thank you so much for that great information. We do actually have a question for you if you have another minute. Great.
Absolutely.
Yeah, it says, can you please tell me why my payments are delayed? All it says is other. What does that mean? And what does pending resolution mean? And how do I fix this?
I'm so sorry. You're going to have to repeat the question. It just now came back in. I don't know why I didn't hear it.
Okay. Sorry about that. Technology. It says, can you please tell me why my payments are delayed? All it says is other, and what does that mean? And what does pending resolution mean? And how do I fix this?
Yeah, so I'm assuming that you already have a Nevada Health Link plan and you're logged into your account on our Nevada Health Link state-based exchange platform. And if you're seeing that information within your account, I highly recommend that you reach out to our customer assistance call center and ask, what the deal is or what this information means. They are open Monday through Friday, 9 to 5, and we also have extended our hours on Saturdays and Sundays from 10 a.m. to 2 p.m. until May 15th. So give that number a call, and it's 1-800-547-2927. If you are having trouble getting connected to someone, then send us an email and I'll make sure that gets directly to our quality assurance team.
Okay, great. We just have one more question, if you don't mind.
Okay.
What if someone has a green card? Do they not qualify for the ECSP?
It depends. You do need to be a Nevada citizen to get registered on a Nevada Health Link plan. I do know that the ECSEP, public charge is not affected, and that information is also on our website. So again, I would call our customer assistance call center and work with them to get your questions answered, and then also get connected with a broker, and your broker should know that information as well. And again, that's free assistance. So if you get connected to a licensed broker or a navigator, that's at no cost to you.
Okay, excellent. Janelle, thank you so much. We appreciate your time, and we appreciate your pups as well. A lot of us are dog lovers, so we understand. We understand what you're going through.
Thank you so much. I appreciate this opportunity.
Okay.
And please let us know if anyone has any questions.
Okay, great. Thank you so much. All right, and now we're going to be moving on to the second part of our webinar this morning. I'd like to introduce Dr. Tiffany Tyler-Garner of DETR. And for this version of this segment, will be audio only, so don't think there's anything wrong with your screen or with the technology. We're going to be switching now to audio only, but I would like to welcome and thank from DETR, Dr. Tiffany Tyler-Garner. Dr. Garner, are you there?
Hello, and thank you for the opportunity to partner with you and getting the word out again to the community.
Well, thank you very much. First of all, would you please give us an update on the status? I know you've added phone lines and certain things like that. If you could give us an update on what's happening with unemployment, that'd be great.
Awesome. There have been some developments, and I'm pleased to report that one of them is that we've now began issuing the additional $600 benefit to current unemployment insurance claimants. So we're excited about that. That is the implementation of the first provision from the CARES Act that we've implemented. So we're excited about that. Additionally, we have established a partnership with a call center vendor to partner around providing general information to the public about unemployment insurance in response to the deluge of calls that we've been receiving. And so now Nevadans can also call 1-800-603-9671 with general unemployment insurance questions. I guess the other update to note is that the demand also continues. We've now seen nearly 300,000 or more claims, with more to continue, we anticipate. So we're also seeing a continuing need for assistance.
Right. Well, Dr. Garner, Tyler-Garner, we sure appreciate your service. I know this has been a very challenging time for you because, the systems were not equipped to handle this volume. I saw Governor Sisolak speaking yesterday and was giving your office accolades for the way you have been able to handle this terrible terrible issue. And so we just want to thank you for your service, first of all, and all that you've done to try to help as many people as fast as you possibly can.
Thank you. And thank you for your leadership around these issues and making sure that individuals are informed as this pandemic and its response evolves.
Well, excellent. Before we move on to the rest of the questions, could we get that phone number one more time? I appreciate that.
Yes, That's 800-603-9671. 800-603-9671.
Okay, very good, very good. Okay, the first question is, how do you apply for both state and federal benefits with DETR? Is there a separate application for the federal benefits? And is the federal portal now available? If not, when do you expect that to be available?
So let me distinguish. So in the case of the federal benefit, that is the additional $600 payment, if you are an existing UI claimant receiving benefits, there's nothing else to do. You will automatically receive that benefit. If what you are referencing is the pandemic unemployment assistance, which is another provision under the CARES Act that provides support to independent contractors and others, we're in the process of fast tracking that implementation, and we'll be sure to notice the community as soon as it comes online.
Okay, very good, thank you. Next question, are independent contractors and 1099 employees covered in state benefits? Are they eligible to collect federal benefits under the CARES Act?
So I want to make sure that we're, the distinction between federal and state benefit, what they may be referencing is the CARES Act and the Pandemic Unemployment Assistance Program, which is a new provision that was recently implemented and signed into law on March 27th. We're in the process of standing up the system to take that claim, those types of claims. And so that's on, in the near future, we hope to be able to offer that program. The traditional unemployment insurance program, which is another federally supported benefit that includes a state component, that is already happening and has consistently happened. So I'm not sure about the distinction between state and federal benefit. I'm wondering if what we're distinguishing between is traditional unemployment insurance and the new provisions under CARES. And so in the case of the new provisions under CARES, we're in the process of implementing each of them and successfully implemented this week the additional $600 benefit for existing claimants.
Okay, very good. Yeah, I believe they were referencing the 600 under the CARES Act. So yes. Next question is, let's see, another person looking for a phone number. So this question is, what is the best number for employers to call to get in contact with your office? And I know, Dr. Tyler-Garner, you're recommending that folks don't call so much as get onto the website, but would you like to distinguish there again as well, please?
We can provide there is a number on the website that employers can contact. It's our contributions division. And so we can provide that information later to you, Ms. Sewald, and encourage folks to identify that information on the website at ui.mv.gov. There is a number for employers.
Okay, very good, thank you. Next question, if a person's unemployment has run out, is there any additional money now that can be received?
There is additional money in the near future, particularly because one of the provisions for the CARES Act is that it provides for an additional 13 weeks of benefits for those who have exhausted it. And so we hope to implement that component in the near future. So the short answer is not yet, but very soon. Okay,
very good. Next question is, I heard on the news that the website was updated and will now take claims by your last name. How do we know which day we need to file?
It does vary by day. So Monday, Tuesday, Wednesday, there's specific alphabets, and the rest of the days of the weeks through Saturday, all claimants can call in. And we have provided the information on our website at ui.mv.gov.
Okay, I have a two-part question next. It's a little bit long, so I might just section it out here. It says, thank you for adding the additional phone line. However, the phone line says it can't answer specific claim questions. Would they be able to tell you if there's something wrong with your claim? That's the first part of the question.
So no, you should call into our traditional call center line, and we're hoping that by establishing this general information line, that the individuals who have been calling on the main call center claim line will now use this new line to free up the ability to respond to these more pointed questions. So the answer is no, general phone line won't answer a detailed claimant concern. However, we're hoping that more of those detailed claimant concerns will be serviced as individuals use the general phone inquiry line instead of getting on the call center line.
Okay, the second part of that question is, secondly, if someone applied March 15th and still has not received payment, but has received the debit card, is there something they should do?
Not at this time. So the registration process triggers the issuance of a debit card. Once the claim has been processed, the card will be loaded with the monetary benefit. So unless they've received an error message or a request to please call in, then they are likely just in the process of having their claim reviewed and approved.
Okay, very good. Next question. Does the CARES Act extend benefits unemployment by 13 weeks? And does anyone need to do anything to get the additional time if they are already receiving benefits?
So they will receive, it does provide for the additional 13 weeks. We're in the process of working through with the Department of Labor what additional supports or documentation may be needed, and then it will be implemented as well. So there is nothing for them to do at this time if they believe they fall into that category. And if additional steps are identified as a part of the guidance and work happening to implement, there'll be widespread notice about what those steps are.
Okay, very good. If a person is furloughed, can they apply for benefits?
If they are furloughed and not receiving income, they can apply for benefits.
Okay, great. I've gotten that question a lot, so thank you. Let's see here. Where do independent contractors go for further assistance? Will we just wait for further information through the site?
Yes. So go to uinv.gov and click on the link for COVID-19 updates. There will be an update regarding when that system goes live for those claims and what the process and requirements are.
Okay. This person says, my unemployment shows, quote, pending resolution, end quote, and my payments are delayed, and the reason says other. Can you tell me what this means and how do I fix this?
There is some issue that must be resolved, requiring the individual to call in to get to resolution, and it could be any number of factors. Without specifically reviewing that claim, I can't speak to what the other means in that case, but we strongly encourage that individual to attempt calling at a non-peak hour to get to resolution.
Okay. Dr. Tyler-Garner, can you tell us what happens if someone made a mistake on their application and clicked the wrong box? Do they call someone, or is there a way to go back into the website and make that correction?
So if they received a prompt, they should follow the prompt, and the prompt could indicate any number of things, including please call in. If they did not receive a prompt and know that they have made an error, they can also email the Internet Help Desk email, which is on ui.nv.gov for assistance. Also, at some point, we may identify that area and reach out directly to them to address it. So
Okay.
It depends on what prompt they received.
Okay, this is another question about independent contractors. Is there an estimated timeline? Is there an estimated timeline for when independent contractors can receive benefits through DETR?
I'm not in a position to provide an exact date today, but we hope to see it implemented in the very near future, are diligently working to fast track the implementation of that provision. We recognize the concern and public outcry for resources at this time, and are working aggressively to ensure that we can get it in place as soon as possible.
Okay, very good. Getting a lot of questions about the PIN reset. Can you remind folks what is the best way to reset their PIN?
To go online at ui.mv.gov and review the resources we've provided to do so. Additionally, they may also go to our YouTube channel, DETR Nevada, where there is a step-by-step guide or tutorial on resetting PINs. If they are unable to go online and review the YouTube video on how to reset your PIN or the step-by-step guide on resetting your PIN, they may also use a special web form at constituent services in the governor's office to expedite PIN resetting as well. So there's several opportunities to get support resetting your PIN. And while we're encouraging as a first step that folks review the online materials to do so, if an individual needs additional support with that, they may also submit that a request through the web form, and it will be addressed through that manner as well.
Okay, this is another question about the furlough situation. When filling out their online filing, what reason should we give if we are furloughed? If we don't see furloughed as an option on the site, do we choose laid off as an option?
And so I want to refrain from giving guidance on what someone should do to talk about their employment status, and note that in the employment insurance handbook that we have online, that there is likely guidance there.
So if they're not seeing an option for furloughed, so if they're furloughed but they're not receiving pay, and if there's no option that quote says furloughed,
if they're furloughed and not receiving pay, they can apply for unemployment insurance. There will be a series of prompts that includes them identifying the employer and wages for a certain period of time. If they are not afforded a button to click for furlough, that may be an indication that some previous prompt that was completed didn't route them to that site. And so I can't be certain if there is a user error happening there to redirect them by phone in this manner. And so I'm suggesting that they review the handbook to make sure that they follow the appropriate prompts and steps. And if they should have a challenge not submitting a claim, then they likely will need to call in. If after reviewing the YouTube channel on completing the claim and reading the handbook, they're unable to find an answer. But there is actually not only a handbook, a fact sheet, and a step-by-step guide for completing the claim online. There's also a series of YouTube videos, including a specific tutorial on completing a claim, where literally we walk them through each screen of the claim process. So I would encourage that individual to review the tutorial.
Okay, this is a question about time frame and timeline expectations. This person says they've been waiting for 3 weeks for unemployment. Should they keep filing even if they're not currently getting anything, or is the one application sufficient?
Yes, please continue to file. Please continue to file. Every claim will be backdated to the first day of eligibility. As a part of this process, if they should fail to file a claim 2 weeks in a row, that may trigger an automatic requirement for them to go in and reopen their claim. So we're strongly encouraging folks who need assistance, who are not receiving income, to file their weekly claim each week. It's also important to note that prior to the pandemic, where we saw these unprecedented numbers, the claims process typically took 7 days, and in a worst case scenario, 21 days. But that was at a time when the claim process included no more than maybe 4,000 or 5,000 claims in any given week. It's important to note that in the last month, we've seen the 3 highest claim weeks ever in the history of Nevada, with it being as high as over 96,000, and on average anywhere between 60 and 90,000. So we don't have a framework for what that process is now. When we look at those kinds of numbers, I can tell you that for some individuals, it's as few as several days. So please continue to file your claim. Please partner with us in being patient and know that you will not lose a benefit or a week that you are eligible for, especially if you continue to complete your claims.
Okay, very good. How long does a person need to have worked at their last job to qualify for unemployment benefits?
There is a wage criteria that typically takes into consideration the last 12 months of wages prior to the claim. Without being able to see the specific details of the claim, I can't provide you a specific number or amount. What I will say as a part of this unprecedented time is that with the CARES Act and its provisions, an individual that did not previously meet the wage requirements for our traditional unemployment insurance process now may qualify for relief under the pandemic unemployment assistance. So that should they find themselves in a situation where they did not meet the wage criteria, there may be opportunity under the new relief that we're attempting to roll out now.
Okay, very good. Can a person collect unemployment if they were fired for poor performance?
Oh, I try to refrain from giving guidance in this manner. What I can tell you is that those considerations happen on a case-by-case basis, and it is not uncommon to see that issue show up as a part of the adjudication process. So if they were previously employed, believe the employer contributed to the unemployment trust fund, have the right to work, went through the I-9 process, they've met some of the basic criteria. The performance issue is another issue that typically is resolved through adjudication.
Okay, so that's a case basis. Okay, not exactly a yes or no answer, is it? Some of these things aren't. Okay. Next question. If a person doesn't feel safe going to work because of COVID-19, can they quit their job and apply for unemployment benefits?
No. There is a formal process for self-quarantining that includes going to a doctor and being referred to the health district. Also, an employer should formally release an individual either by furlough or layoff for them to be eligible for the unemployment insurance program as it's traditionally structured. And it is also important to note that even under the CARES Act and its provisions, should an individual arbitrarily decide to release themselves from employment, like quit so that they may receive the benefit, that according to the federal guidance we received, that constitutes fraud. So we are strongly discouraging or dissuading individuals from arbitrarily or informally going through the process of quarantining themselves without support from that employer or a formal designation from a health provider around needing that kind of provision, and definitely dissuade folks from quitting their jobs to receive relief.
Okay. Earlier, you mentioned the $600 will be paid to those already receiving unemployment benefits. Did that start this week or will it begin next week?
It actually started this week. So there are folks today receiving payments, and we anticipate a staggered distribution throughout this week that includes back payments for those individuals as it relates to the $600 benefit. So folks are receiving that as we speak.
Okay, very good. Next question. If the original claim stated return of work date on April 18th due to the original 30-day close, is a new claim to be opened or just keep original claim and adding weekly files?
I would encourage that individual to review the unemployment insurance handbook online, and if the guidance is not clear to them there, to call in for verification. I want to refrain from answering specific claim questions because oftentimes there are additional considerations that factor into what the resolution is.
Okay, Very good. Does an employer have to verify the claim once it's filed on the UI site?
There usually is some reconciliation process that happens behind the scenes on the back end to ensure that it is a valid claim.
Okay. How long is it taking for the appeals process right now?
That process is varying. Like as I indicated before, this process, as it currently is not one that we had a framework or a trend that we could review to say, here's what we anticipate the average time would be. Prior to this pandemic, worst case scenario, 21 days, an average of 7 days. But that was at a time when the call volume was anywhere from 4,000 to 5,000 in any given week at the most, with a nearly 40 time increase in the number of claims that we've been receiving. That number is varying. And that's why we are strongly encouraging individuals to please review the online resources before they attempt their claim, because if they should respond in a way that creates an error or creates disparities, it can delay the process. So it's critical that folks, before they attempt the claim, review the online resources to ensure that they, one, understand what is needed for them during the claim process, as well as have context for what the questions or prompts are about and what the appropriate responses are as a part of that process to mitigate any potential delays. We have seen instances where folks are kind of taking a trial and error approach to it, and that is absolutely creating challenges, including in some instances kicking them out of the system, because our other responsibility beyond ensuring that folks are provided the benefits is making sure that we do everything we can to mitigate fraud or reduce fraud. So multiple attempts at passwords or errors that appear to not match with the other data we have regarding the claim can create delays as a part of our fraud protection efforts.
Okay, very good. Next question is, if another timing question, if there were no issues or problems with an application, what would you say is the average time for receiving benefits from the date that the claim was filed?
Prior to the pandemic, on average, it was 7 days, with 21 days being the worst case scenario. Given the magnitude of volume we're seeing, we do not have a trend that we can point to indicate what that is in this time.
Okay. So Dr. Tyler-Garner, I need to clarify this again because we're getting a lot of messages from folks about this furloughed option. Just to clarify, and I know it's tough to give specific, advice, but it says several are reporting that furloughed is not an option. And I know you said to check the handbook. This question says, should they reach out to their employer for clarification on what they should choose to ensure that they are not flagged for fraud in the system?
Furlough is an option in the system, and we have encouraged employers to leverage or use or indicate furlough when they believe that they are going to bring their workforce back. So it is an option in the system. If they have arrived at a prompt that is not allowing them to click furlough or indicate furlough, that may be indicative of there being some error in the previous fields or responses they have provided. And so we're asking individuals to please review that handbook to ensure they're clear about the guidance and the response. And if they are having an issue, they do need to call into the call center to get more detail or support there around their individual cases.
Okay, very good. This next question is around the backdating that the governor spoke about yesterday and that you've already spoken about on this call today. What did the governor mean when he said that he instructed DETR to backdate all unemployment claims to March 13th? Does that mean if a person was let go, say April 1st, and they qualify for employment, would that mean that once in the system, it goes back to March 13th, or only when the person was actually not working and receiving pay.
Only when the so that was a reference to backdating to the first date of eligibility. So there wouldn't be an instance where we would be paying you and your employer would be paying you. So it's back to the date that you were released and not receiving income. So it's back to the first date of eligibility according to the criteria for unemployment insurance.
Okay. Very good, very good. Next question. When filing for the unemployment, it says that, and this is another specific question, but bear with us. When filing for the unemployment, it says that I did not have any income, but I checked with my previous employer and they have filed their SUI reports. Do I need to do anything or can they do something?
It'll likely go to adjudication if you have filed and the internal records that have been submitted are indicating that there isn't a wage there. They do have the right to appeal, and it likely will go through the adjudication process.
Okay. Very good. Very good. For to collect unemployment benefits, you have to say you are looking for work every single week. Can you clarify around that?
Yeah, we have during this period of time where we recognize that there may not be work there. You may note that one of the first executive orders or directives that we received was the waiving of the work search requirement. And so folks, we have established a process by which folks can bypass that component in the system. And there is an online video tutorial as well as a step-by-step guide for bypassing the work search requirement on the website. So if they go to uinv.gov, not only is there a tutorial to walk them through how to bypass it, there's also a step-by-step guide on how to bypass it. And it's important to note that that requirement was waived.
Okay. Next question. Will benefits be paid to employees who take a temporary leave of absence?
As in, I probably would need more detail to speak to that. But let me just say theoretically, individuals, in order to leverage the formal resources provided by unemployment insurance, an individual cannot informally or arbitrarily choose not to work and apply.
Okay. Next question. If a company offers a person a grant, so to speak, to cover the difference between benefits and normal pay, how does that impact your eligibility for unemployment?
It may impact it, especially since individuals are required to report their income, any income they receive. So I would encourage that individual to call in and get guidance after they have reviewed the unemployment insurance handbook that we have online.
Okay, great. Next question. What happens if the employer recalls the employee?
I'm sorry, I lost you. The last thing I heard is what happens if the employer recalls
The employees back to work?
then I don't understand the question. They should return to work, particularly under the CARES Act and some of the other federal legislation. They've been clear about the expectation that if an individual can work from home, or if an individual can work with their employer within this context, then they should do so. And if they choose not to and then apply for relief, that will constitute fraud.
Okay, very good. All right, Dr. Tyler-Garner, once again, we sure appreciate your service. I actually did just have another question come in. If you have just one more moment, we appreciate it.
Okay.
If I receive 2 weeks of severance, I apply. So I applied my last day I worked, or after the 2 weeks of pay is up if I receive 2 weeks of?
Ideally, after the 2 weeks of pay is up, because you ultimately need to report the income.
Right.
So
Okay.
you would either be applying and then reporting that income, which would likely could have some implications in terms of eligibility, or you would apply after it has been exhausted and be reporting that you don't have income.
Okay. If an employee commutes to another state for regular employment and is terminated or laid off, would the employee be eligible to apply for Nevada unemployment benefits, or would the employee be covered under the UI system in the state where the employee worked?
The individual may apply where they live, and then we work across states to evaluate and assess the benefit based on that income. So there are instances where individuals may have income from another state or more than one state, and we work across states to address, reconcile, and then issue a benefit. But typically they apply in the state where they live.
Okay, very good. One last question. Regarding the fraud with employees not coming back, what should, from an employer standpoint, what do you recommend that the employers do?
They can reach out to contributions and report it.
Okay. Great. I think you mentioned that on a call the other day as well. Dr. Tyler-Garner, we so appreciate your time today, and we appreciate your service. I know this has been a very challenging time for you personally, not to mention those in your office. So we just want to thank you for your work, and thank you for keeping us all informed by doing these webinars with the Vegas Chamber. Thank you so much.
Thank you, and thank you for your leadership.
All right, and we want to thank everybody else for joining us on today's call. As resources and new information become available, you can count on the Vegas Chamber to keep you informed. Don't forget our webinars tomorrow with Senator Jackie Rosen, and then Eggs and Issues on Friday with Congresswoman Susie Lee. Thanks again, everyone, and have a safe and healthy rest of your day. Bye-bye.
Bye-bye. Thank you.